Welcome to Muddy River News this week, furnished by Harvey's. I'm Bob Goff. Well, Quincy Medical Group has received approval from the state of Illinois to build its birthing center and small hospital out at the Quincy Town Center. So I thought it was time to talk to CEO Carol Brockmiller once again. Hi there.
Hi, good afternoon.
Congratulations.
Thank you. Thank you.
So, you digging dirt? Are we getting going? Give us an update.
Yes, figuratively speaking, there is, paperwork and things to be done. Our partners, Cullinan Properties, have been terrific to us, and the approval on April 26th just sort of launched a series of things that need to happen before we actually break ground. The birth center is a renovation, so that will be on the west side of where our Cancer Institute is now. Private entrance, private experience, that will be a renovation. The QMG hospital will be built at the back of the mall, although it will have a footprint inside the mall so that, you can leave and be inside the mall and vice versa. And then there will be a crosswalk over the mall connecting the surgery center and the hospital. And so, there's groundwork being done and, just the lots of laying of groundwork, figuratively speaking, before we can actually put a shovel in the ground. But yeah, we are moving forward because once we got approval and received our letters from the CON State Board that confirmed that, we've waited a long time for this, so we got started.
And we have a rendering of the facility that QMG provided us. It's at the bottom of this interview. You can look at it. So, and as I looked at it, yes, and then to the north, that's where the new construction will be then.
Yes. So what we call the back of the mall, but yes, the north side of the mall. It is where Justice and Payless and the Dress Barn were. And so, we're beginning to just sort of level those playing fields and what that looks like. And we're sort of across from Dairy Queen. And we're putting up some signs to let people know where we will be, future home of the QMG hospital sort of thing, so that they can go out there and identify what that might look like in the future.
All right, and then, in perfect conditions, dealing with supply chains and getting things and doing the things you have to do to make this happen, we're looking at September of 25?
So we always project kind of worst case scenario.
Sure.
Because of those things. I tell myself it's 2 or 3 years, but the construction individuals tell me it's probably longer than that. Okay. So, there's so many factors. That's why we wanted to get started. And so, somewhere between 3 and 5, I suppose, something like that.
Well, I think that when you look at your facility that's currently at the town center, when you did the renovation of Bergner's, it wasn't easy, but it was easier than building from scratch. Now you are doing another renovation, but you're also doing a building from scratch.
Yes.
So, and this overall expansion, it's roughly a little over $60 million, I believe, was the figure you guys gave us. Yes. And again, I guess I want you to kind of reiterate why you and your QMG partners felt this was needed.
So about 4 years ago is when we started all the initiatives, and the physicians are looking for anything that supports value-based care. Value-based care is different than pay per click, pay per office visit. And so as the federal government moves toward paying for value, which can include the cost of the care, the quality provided, and the patient experience. So those 3 things are informing how physicians are reimbursed for their services. So if that's the case, then physicians want to be able to manage that. They want to manage their patient across the entire continuum. So we are in the outpatient services, have been forever. There's 12 acres downtown still that will remain our downtown campus. We have a hospital at home program that really we just need for Medicare to approve reimbursement and approve someone other than a hospital delivering that. So hospital care in a patient's home, and that will, that's an outpatient service. It will save all kinds of money, higher patient satisfaction, and the quality is extraordinary. Has to be the right patient in the right circumstances, all those things. So then we added the birth center and of course the surgery center. And then the last piece of the puzzle for the physicians really was that inpatient experience. Because things are moving to an outpatient setting, we only went with 25 beds because we don't want to overbuild. We don't need to replicate services in town. It really was just if this is how we will be measured upon our success in caring for a patient and providing quality care, then we want to be able to do that at the lowest cost possible. It's a not-for-profit hospital. It is designed with like outpatient pricing. It's not a revenue stream. It's not, the profits can't even come back to QMG as the for-profit. The profits can't go to the physicians. It is just an alternative, along with hospital, home and surgery center and birth center and outpatient setting, that allows the physicians to truly manage the care of their patients, manage the cost of the care, ideally provide the kind of care and service that satisfies patients. So, you know, it's been 4 years in the making, and that was sort of the last large strategic initiative that we felt like we needed to complete so that physicians really could provide the kind of care that we believe Medicare and Medicaid and then all of the commercial payers are not just hoping for, but they're getting closer and closer every day, and we want to lead the way. We want to be there.
So the nonprofit is a separate arm then, kind of?
It will be a wholly owned subsidiary of QMG, but we designed it as a not-for-profit hospital. It will pay taxes, though. That was just important to us, that, you know, we pay our way, pay our fair share. And so the profits of the hospital, as modest as they are, will be returned to the hospital for sustainability and investment and innovation and future growth, but there's not profits to be distributed to anyone, anywhere. It is just to sustain itself. But we have you know, it's a small format hospital, so even the way it's designed, it's super efficient in space, in concept. You know, it's just different than some of the traditional hospitals of decades. It's a full service community hospital, but it is designed very efficiently. It functions very efficiently. The staffing is very efficient. And so as a result of that, the costs are less. And we designed it not as a profit center. It's just it's a delivery tool along all of the continuum of care that the physicians felt like was important.
And I think that's something that, you know, when people, you know, talk about with, you know, with Quincy Medical Group, you know, that part of it being for profit, that means you pay property taxes.
Oh, yeah.
And you talked about how in downtown, we've talked about before how, you know, you're when downtown is, you know, when like the district's trying to do their SSAs and things like that, you guys have always supported that sort of thing because you're one of the primary taxpayers of that. So again, you talk about, you know, being a good neighbor and doing what's best for the community, which is, you know, what everybody ought to do.
Mm-hmm. Yeah, I mean, that is the goal, and physicians have invested in downtown and now at the East End and all of the things that are happening out Broadway. I mean, that's pretty exciting, but yet our original home is downtown. That's super important to us, always has been. But this will, when we say that we're trying to transform healthcare, we mean it in a discernible, meaningful way for the average person. That if insurers pay less and patients pay less and employers pay less, and yet the care is amazing and the relationship between the physician and patient is as good, if not better, than always before, then we've done our jobs and actually, you know, contributed to the economy of Quincy. And we're 85 years old this year, and, you know, the first 85 years have been great, and we want to celebrate those, but it's the next 85 years of, you know, things that you and I won't be around for necessarily, but we want to make sure that, we want to make sure that healthcare is moving along with the times, and that QMG as a community partner is doing its part.
So there's no competition between you and Target to try to see which one can get built first, right?
No, I don't want to compete with Target ever. I'm as happy as everybody else is that they're coming, and, you know, you can just see things from the riverfront clear to way out east. There's just really good things happening. And I think for population purposes and economic purposes and jobs and just all sorts of things that come with investments like that from whether it's QMG or the out-of-town folks like Target, that's huge.
Broadway buildings look better when the lights are on.
You better believe it.
You know, we don't want just, you know, we had that, you know, when everything, you know, bolted at once, it seemed like with Shopko, Kmart, whatever, it was just like, wow. And then, you know, when you guys made your move to take Bergner's and reinvigorate that space, and, you know, it's nice to have cars at the town center again. And again, I think that's what people want. We want to see activity. We want to, you know, we don't want to be seen as a community on the decline.
Yeah, nobody wants to see that. And, you know, for all the people that have stayed in the mall, have stayed around the mall, have stayed on that Broadway corridor as, you know, some lights went dark. We do want to be good neighbors. They've been really good to us out at the Cancer Institute and the Surgery Center. And so, you know, just to have people be able to leave our facilities and be inside the mall and vice versa, just for a walk, a pizza, a birthday card, you know, whatever you need out there, we want to contribute, not hurt anybody in any way. Like everybody wins, all boats will rise.
Absolutely.
That campus is important, and seeing it not be dark, right? I mean, to see that and to know that, you know, there's really good things happening out there.
We're done with COVID, right? Please say yes.
Boy, you know, whatever the name of this current version is, you know, it doesn't make you as sick and it doesn't last as long, but it is mighty contagious.
Are we starting to see some uptick again?
Yeah, a little bit. A little bit.
You weren't. That wasn't the news I wanted to hear.
Wash your hands.
Right?
Yeah, it's so hard because we all want normalcy and we want, you know, togetherness, and the more you can do that outside, the better.
Well, you know, when I went in with Ashley Conrad when we shot the piece with you guys yesterday regarding her cosmetic, it's not Botox, it's the other thing, but it was, you know, it was all right, and you guys people were great to deal with. Dr. Levin was wonderful, but I had to put a mask on again, and I was like, I'm so like not used to not having to do it, except unless I go, you know, to a healthcare facility, which is fine, and I'm going to be a good guy and do it. But still, it's like, oh, okay, you know, you just do it.
Imagine that for 2 full years, nonstop, no break. They haven't taken them off yet. If you're frontline, if you're a care delivery, that is, holy cow. Those people are like, kudos to them.
I know. I mean, yeah.
That's a lot.
Anybody that's worked at your facility or blessing, it's just like to have to do that and go through that. It is rough, and you know, every time it looks like we are past it, you know, we see these spikes and we see these things, and we hope it's not. You know, we hope it's not as contagious. We hope it doesn't make you as sick, and we hope that everybody's gotten the shots and the boosters and all that stuff. And I guess that's the way. You know, again, and if it's going to be a thing where we have to deal with it, where we get our annual COVID shot along with our annual flu shot and whatever,
I think it will be.
That's life. So,
Agreed.
do you, when you talk to your partners also in the corporation at their other facilities, how often do you talk to them to deal with not only COVID issues but just issues? Do you have like weekly conference calls or daily or whatever to say, hey, this is what's happening in our community?
Regional healthcare partners or our new partner, Dooley Health and Care, or both? Like
all the above.
So yes, I just had a conversation with Carthage and Rushville CEOs today, and they definitely don't have as many people hospitalized for COVID. They just see more people experiencing it. So this phase that we're in, it's not as bad and it doesn't take you down, not the average bear anyway. And yeah, so we stay in touch about every 2 weeks. The Dooley Health and Care folks in Chicagoland, so their COVID experience is, you know, just sort of magnified but similar to ours. So, you know, if we see it expounded, that, you know, it's Chicagoland. It's just a little bit different, but it's definitely spiking. State of Illinois knows it. Governor Pritzker knows it. You know, there's certain hot spots in the state of Illinois now. We are not yet one of those, and you know, it's frustrating, but it's here, and we got to protect ourselves a little bit.
Well, again, and it's just, everybody, if you get your boosters or whatever, that's going to be the best way to take care of that. So, you mentioned Carthage and the other areas there. The facilities that are there, when you look at, I guess when you talk about how hospitals are structured in certain parts, when you're dealing with Carthage, how do you, I mean, it's a smaller population, it's obviously, but you want people there have to have the same care and the same immediacy and all that. What do they try to do is it on a smaller level that Quincy does? It's basically the same care?
Yes.
How does that work?
That's a good question. So first and foremost, QMG physicians travel to, 12 to 15 different outreach locations in the tri-states, and they deliver care on site. They will do procedures on site at area hospitals. Go see the patients, usually a specialist. We have, our rural health clinics in probably the same number of locations, but our specialists have been traveling for years now. So we serve Carthage, we serve Rushville and Bowling Green and Pittsfield, and we'll send specialists there, usually on behalf of the local hospital. So then from a hospital perspective, the QMG small format hospital will look like in services and function much like a community hospital like Carthage and Rushville. It's the same kind of community concept. So ER, ORs, labor and delivery with C-section suite, 25 med-surg beds. 97% of what walks in the ER can be serviced in a community hospital. Sometimes it needs to be transferred. Sometimes, a patient might need even tertiary care out of town. If we can transfer locally to Blessing Hospital, great. If patients need to be transferred, they will be transferred to, there's all of the obvious places that folks are transferred to now. So we function very much like Carthage and Rushville. They are part of the solution for our 25 beds because as they don't need as many beds in their communities, they were willing to actually relinquish some of theirs. So they're each certified for 25 beds. Their census isn't 25 people per day. And so they are actually, and prudently, willing to give beds back to the state of Illinois, and it supported us being approved for 25 beds. It's not a they give 3 and we get 3. It's just a philosophical concept that they said, you know, if we're overbedded in this region according to statistics and utilization, we are willing to give some of our beds up if that helps Quincy provide this service. It's just a partnership. Because we've served those areas for so long, our physicians really enjoy outreach. There's something different about it. There's something very fulfilling about going to see patients in their hometown and not making them travel and making a difference. And I don't know, it's just, there's something about outreach. Our physicians have traveled a long way for years. Dr. Bozdek from GI, who just retired, he had driven to Rushville every week for 15 years to see GI patients up there. And that means that Rushville has a physician. They wouldn't be able to recruit a full-time physician to support everybody up there, but a day-a-week guy who will come up and we're in the physician business. That's what we do. And so as we recruit to serve the area, it serves everybody. And we're not there to bring people to Quincy. We're there to see them in their hometown, and it works. It's been wonderful. But because of those relationships, Carthage and Rushville were both willing to consider, like, hey, could we have some of your beds?
Yeah,
No?
I knew there was some sort of give and take in there. I just wanted to get an explanation on that. Thank you for that.
Yeah.
So, and thanks for the time. I appreciate it. And like I said, we'll be anxious to go to the groundbreaking and see what's next.
We'll invite you.
Thanks.
Yeah,
All right.
of course.
It's Carol Brockmiller, Quincy Medical Group, and I'm Bob Goff with Muddy River News. That's Muddy River News this week. Have a great week.